All right, so Martin is asking what trauma labs are actually worthwhile other than type and screen. Do you want me to start with this or you want it, Jed?
I'll kick it off. So it kind of depends on, like anything else we do, clinical scenario. So it depends on what happened to the patient. If it's something like kid's riding his bike, goes over, lands on the handlebars, I would want a lipase in that case because you can get a traumatic pancreatitis, things of that nature. If it's grandma had a ground level fall kind of onto her hip and back, I'm probably less inclined to get those type of labs other than, if you just got to run the syncable, was she anemic, et cetera. But the huge gamut of labs we get for every trauma, unless we save them that bill by popping them down to a 3, I generally disagree with.
And I really agree. I think the traumas really fall into like 2 categories. One is the fairly sick person that you realistically think a surgeon might touch and that you're maybe getting a pan scan and they're likely getting admitted. Those folks, I think trauma labs are beneficial for what Jed mentioned. If you have a bump in your LFTs, that's relevant. You kind of want to know what their baseline hemoglobin is, even if it doesn't affect your management. Finding out that when they hit the door, their hemoglobin was 12 means something when their hemoglobin's 8 tomorrow. So, if you're realistically looking at a surgeon needs to touch this person or they're getting admitted, I think the full show is probably overkill for a lot of folks, but you'd be surprised the number of times that there's this curious bump in the lipase or something like that, and it would be missed. And especially if you're going to be fairly conservative with what you're scanning, which is more my style. I don't believe in pan scanning every last trauma that hits the door. You kind of need to make up for it with doing some extra labs. Now, the person that was in a little fender bender, they look great. Maybe you clear their C-collar plus minus a chest x-ray, that kind of deal. That person probably doesn't need any labs. So a lot of your level 3 traumas that you're like, this person looks great. If they don't actually have a broken leg when we take the x-rays, we're not looking at admitting them. They're going to get cleared and walk around and be fine to go home. Labs are very unlikely to actually pay dividends there, and generally you don't need them. You can save a lot of money that way.